Support the patient's selected arm and extend it to form a straight line from the shoulder to the wrist. Identify the best sites for venipuncture per the organization's practice. If possible, choose a vein that is easily visible without applying a tourniquet. If a tourniquet is deemed necessary, apply a single-use tourniquet 4 to 5 finger widths above the selected venipuncture site. Do not keep the tourniquet on the patient longer than 1 minute. Palpate the selected vein for firmness and rebound. Instruct the patient to make a fist without vigorously opening and closing the fist. Release the tourniquet. As prescribed or per the organization's practice, apply a topical anesthetic if required to reduce pain. Remove the anesthetic completely from the skin after the prescribed dwell time. Prepare the collection equipment. Ensure that a winged butterfly venipuncture needle with tubing and a safety device is securely attached to the vacuum extraction system collection barrel. Alternatively, and if required, remove the sterile cap from the rubber-sheathed end of the winged butterfly needle tubing and make the lure lock connection of the sheathed needle and the collection barrel. If a single-ended winged butterfly needle with tubing is used, make the lure lock connection between the needle and the collection barrel housing of a sheathed needle. Keep the needle hub and the connection sites sterile. Disinfect culture bottle tops with 70% isopropyl alcohol. If using a vacuum extraction system, position the culture bottle securely, upright, and close enough to the venipuncture site so that the tubing connected to the needle reaches from the selected vein to the upright bottle. Rest the collection barrel over the aerobic bottle. Wait to puncture the rubber stopper with the sheathed needle. If using a winged butterfly or straight needle attached to a syringe, position the culture bottle securely upright and place a sterile transfer device housing a rubber-sheathed needle within reach. Relocate the selected venipuncture site. Perform hand hygiene and don gloves. Prepare the venipuncture site. If the skin needs cleansing, use soap and water first, then allow to dry completely. Prepare the insertion site with an organization-approved antiseptic for routine venipuncture. Do not touch the site after preparation unless sterile gloves are worn. Obtain the blood cultures. Reapply the tourniquet and locate the vein. Remove the cap from the venipuncture needle, maintaining the needle's sterility. Inform the patient that he or she will feel a stick. Place the thumb or forefinger of the non-dominant hand distal to the venipuncture site. Gently stretch the patient's skin until it is taut and the vein is stabilized. Hold a butterfly needle by the wings. Hold a straight needle attached to a syringe at the hub. Insert the needle at a 30-degree angle with the bevel up, just distal to the selected site. Slowly insert the needle into the vein. Winged butterfly needle device method. Transfer the specimen to the culture bottles. Without dislodging the needle from the vein, push the attached collection barrel onto the prepared aerobic culture bottle by inserting the sheathed needle through the rubber stopper so the vacuum pulls the blood into the bottle. Collect a minimum of 10 milliliters of blood into the aerobic bottle. Detach the collection barrel from the aerobic culture bottle and insert the sheathed needle through the rubber stopper of the prepared anaerobic bottle. Ensure that the anaerobic culture bottle receives a minimum of 10 milliliters of blood. Detach the collection barrel after the anaerobic bottle is filled with 10 milliliters. If additional blood specimens are required for other laboratory tests, insert additional specimen tubes into the collection barrel and engage the sheathed needle as needed. After tubes that contain additives are filled with blood, gently turn them up and down immediately. If the blood flows sufficiently into the bottles or tubes, and if a tourniquet was used, release the tourniquet just before filling the last specimen tube or syringe. If blood flow is slow, wait to release the tourniquet until the last bottle or tube is almost full. Apply a sterile 2 by 2 inch gauze pad over the venipuncture site, but do not apply pressure. Quickly but carefully withdraw the needle from the vein, activating the safety mechanism. Immediately apply pressure over the venipuncture site with gauze until bleeding stops. Observe the venipuncture site for bleeding for 5 to 10 seconds before applying a bandage. Use tape or a bandage to secure the gauze and allow it to remain in place for at least 15 minutes. Instruct the patient not to bend his or her arm. Needle and syringe method. Gently aspirate 20 milliliters of blood into an appropriate size syringe. If the blood is flowing sufficiently, and if a tourniquet was used, release the tourniquet just before filling the syringe. Apply a sterile 2 by 2 inch gauze pad over the venipuncture site, but do not apply pressure. Quickly but carefully withdraw the needle from the vein. Immediately apply pressure over the venipuncture site with gauze until bleeding stops. Transfer the specimen to the culture bottles. Distribute the blood volume evenly between the culture bottles without replacing the needle. If both anaerobic and aerobic samples are needed, fill the anaerobic culture bottle first. Keep the bottle and syringe upright and inoculate the anaerobic bottle, ensuring that no air is transferred from the syringe into the anaerobic bottle. Inoculate the aerobic culture bottle with a minimum of 10 milliliters for the most accurate results. Immediately discard the remaining sharp devices, including the collection barrel and transfer device, into an easily accessible sharps container. Gently mix the culture broth and blood in the bottles. Examine the culture bottles for signs of external contamination with blood. Decontaminate the bottles if necessary per the laboratory's practice. In the presence of the patient, label the specimens per the organization's practice. Central venous access device method. If appropriate, stop all medications and IV solutions infusing through the central venous access device, CVAD, and flush per the organization's practice. Select the appropriate lumen for blood sampling and clamp the port. Change the needleless connector cap using aseptic technique. Ensure that no air enters the system. Disinfect the needleless connector according to the organization's practice. Allow it to dry completely. Attach the appropriate size syringe to the needleless connector. Unclamp the port. Gently aspirate a minimum of 10 milliliters of blood per bottle for accurate results. Do not discard, waste, the initial sample from a CVAD. Transfer the specimen to the culture bottles. Connect the syringe to a sterile safety transfer device to fill the bottles, ensuring that the syringe nozzle is not contaminated. Do not connect blood culture vacuum bottles directly to the CVAD via the sampling device due to the risk of broth medium reflux back into the vein. Keep the bottle and syringe upright and inoculate the prepared anaerobic culture bottle first, ensuring that no air is transferred from the syringe into the anaerobic bottle. Inject 10 milliliters of blood into each bottle. If a second set of cultures from the CVAD is required, repeat the procedure from a second port. Gently mix the culture broth and blood in the bottles. Lock the port with solution per the manufacturer's recommendation and per the organization's practice. Reclamp the port before removing the syringe. Open the clamp on port with the IV tubing and resume the ordered infusion. Prepare the specimens for the laboratory.